Welcome to Module 3 of Health and Safety for Center-Based Educators. This module is the third in a four-part online series. It focuses on supervision and interactions in a child care center. This module will discuss state regulations and standards that impact how you should supervise and interact with children in your care. Supervision is essential for keeping young children healthy and safe. Children in a child care center or preschool need to be seen and heard at all times. Rhode Island Department of Children, Youth and Families, or DCYF, requires constant supervision of children, including in the bathroom and during rest time. To ensure proper supervision and safety, DCYF regulations require specific classroom staffing ratios, which vary depending on the age of the children in the class or group. If you care for children between the ages of 6 weeks and 18 months, the staffing ratio requires 1 adult for every 4 children, with a maximum of 8 children in the classroom. In classrooms with children from 18 months to 3 years of age, the ratio is 1 adult for every 6 children, with a maximum of 12 children in the classroom. In a classroom with 3-year-olds, the ratio is 1 adult for every 9 children, with a maximum of 18 children in the room. In a 4-year-old classroom, the ratio is 1 adult for every 10 children, with a maximum of 20 children per room. In a classroom with 5-year-olds, the ratio is 1 adult for every 12 children, with a maximum of 24 children per room. For classrooms with mixed-age children, the proper adult-child staffing ratio is determined by the age of the youngest child in the group. For example, in a room with 3 to 5-year-olds, the staffing ratio for 3-year-olds must be followed. Keep in mind that volunteers within a classroom do not count when determining the ratio in the room. Additionally, children in preschool programs and in school-age programs can never be combined. Using cell phones and social media have become regular habits in today's society, but they are not necessarily appropriate in child care settings. DCYF regulations prohibit the use of cell phones while supervising children in a child care center. If you are using mobile devices like electronic tablets to capture assessment information in your classroom, the devices should belong to the program and be designated for program use only. To ensure children's confidentiality, you must never use your personal phone or camera to take pictures of children in your care. Additionally, all child care centers and preschools should have a social media policy that details whether and how staff can use social media at work. Check with your program director to see what the social media policy is for your program. It is recommended that you keep personal social media pages separate from work. While supervising children indoors, make sure all exterior doors to a classroom are locked at all times unless monitored by a staff member. When you and the children are outside in a play space that is adjacent to the classroom exterior door, the door can be unlocked as long as a staff member can monitor it. However, as soon as you come back inside, the door must be locked behind you. It must be locked in such a way that you and the children can get outside if you need to, but no one can enter through the door. As you think about the equipment, toys, and materials that children have access to in your classroom or program, make sure they are free from hazards, such as lead paint, insects, protruding nails, or rust. All items must be kept clean and in good repair. If you notice a material or piece of equipment is broken, remove it immediately from the area used with children. Keep in mind that infants and toddlers must be protected from small objects that can be swallowed, such as beads, building blocks, or balls. Store these items in closed containers out of the way of the youngest hands. How you interact with children is as essential for their healthy development as the cleanliness and safety of the environment. When caring for children, use positive and consistent messages and methods. Gently guide children on tasks, encouraging appropriate behavior and setting clear limits and rules that children can understand. Support children's accomplishments and encourage their attempts at new tasks. If children are engaging in inappropriate actions, redirect them to activities that are more favorable. Never hit a child or engage in any form of physical punishment, humiliation, or verbal abuse. Never take away children's meals, snacks, or outside time as a form of discipline. We have all heard about timeouts, but these are a tool that should only be used in extreme cases when everyone needs some time to take a break. For the child, a timeout should not exceed 1 minute for each year of the child's age. This means a 3-year-old should not be given a timeout longer than 3 minutes. Shaken baby syndrome is the occurrence of a brain injury due to a shaking of a child. In infants, mild shaking, roughhousing, and tossing can result in serious permanent brain damage or death, as infants' brains are very fragile and vulnerable. Usually this kind of shaking happens when a parent or caregiver is feeling frustrated over a crying or distraught infant or child. Oftentimes, the caregiver can't calm the child down and doesn't know why the child cannot be consoled. This is one reason it is critically important that center-based educators know what the children in their care may be going through each day, whether it's teething or colic or starting a new habit at home. Knowing what is happening with the child can help you be more understanding and patient with them. This is why regular and thoughtful communication with children's families is so essential. If you feel yourself getting upset or impatient with a child, go get another adult to care for the child so you can walk away and calm down. Put the baby or child down in a safe place and take a few deep breaths. We want to take a moment here to remind everyone who cares for children in a child care setting that you are a legally bound, mandated reporter. This means that you are required to report to DCYF anything you see or hear that might indicate a child is being abused or neglected. If you see signs of maltreatment or suspect abuse in any way, call the phone number on the screen. This concludes Module 3, which focused on safe supervision and interactions with young children. For more information, please contact the Center for Early Learning Professionals info line.